Welcome to The Explainer. I am absolutely thrilled to have you here today. We are taking on a truly fascinating journey. We're mapping the human mind. Let's be real, the mind is incredible, but when it doesn't function the way we expect it to, it can feel like a complete mystery. In this explainer, we are going to demystify 12 distinct mental health conditions. By breaking them all down systematically, we're going to make the complex inner workings of the brain structured, understandable, and highly accessible.
So how well do you really know the human mind? We throw around terms like depressed, anxious, or OCD all the time in our daily lives, but do we actually understand the clinical realities behind those words? The brain is profoundly complex, but when we take the time to organize the information, it becomes incredibly fascinating. So let's build a proper foundation of understanding together.
To keep us on track, here's our agenda for today. First up, moods and emotional extremes. Second, anxiety, trauma, and compulsions. Third is perception and identity. And finally, development and coping behaviors. Let's dive right in.
Section 1. Moods and emotional extremes. Starting off with major depressive disorder, or MDD. There's this massive misconception out there that depression is simply just feeling sad, but it's really not. It is a persistent, heavy anchor of hopelessness. Imagine completely losing interest in the activities you used to absolutely love. And on top of that, it manifests physically. People with MDD experience tangible, real changes in their sleep patterns, their appetite, and their overall energy levels. It's an all-encompassing condition that requires real clinical support.
Now, contrast that with bipolar disorder. This condition is all about stark, exhausting contrasts. Actually, it's a striking fact that it can sometimes take up to 10 whole years for someone to receive an accurate bipolar diagnosis because the symptoms are just so incredibly complex. On one hand, you have manic highs, bouts of immense energy, euphoria, and impulsive decisions. But then the pendulum swings. On the exact opposite side, you have depressive lows, where an individual feels extremely down, very similar to the severe lows of major depressive disorder. These unpredictable cycles can be massively disruptive to a person's daily life.
Then we have borderline personality disorder, or BPD. This creates a literal emotional roller coaster. It strips away a person's ability to regulate their moods. You might see a rapid shift from anger to sadness or anxiety to happiness in a flash. Coupled with this is an intense, driving fear of abandonment and impulsive behaviors, which unfortunately can range from reckless spending to tragic self-harm. This volatility naturally makes maintaining stable relationships incredibly difficult for them.
But here's the crucial takeaway for this section. No one has to be stuck in these extremes forever. Real hope and help exist. For MDD, therapy paired with antidepressant medications is highly effective. For bipolar disorder, those extreme swings are managed using a combination of psychotherapy and mood stabilizers. And for BPD, there's a specialized form of treatment called dialectical behavioral therapy, or DBT, which is specifically designed to help people manage those intense emotions and build much healthier, lasting relationships.
Moving right along to Section 2. Anxiety, trauma, and compulsions.
So anxiety isn't just your run-of-the-mill everyday stress. It's an excessive fear that literally rewires a person's daily life. And it takes a few different forms. Generalized anxiety disorder is a constant, baseless worry. Panic disorder strikes suddenly with intense physical terror, triggering symptoms like heart palpitations, shortness of breath, and dizziness. And social anxiety disorder is a paralyzing fear of judgment or humiliation in social situations. The sad reality here is that people with these disorders often avoid their triggers entirely, basically shrinking their world just to stay safe.
Next up is obsessive-compulsive disorder, better known as OCD, which operates in a totally debilitating two-part cycle. First come the obsessions. These are unwanted, invasive thoughts that loop endlessly in the mind. Then come the compulsions, the urgent, relentless need to perform specific behaviors or rituals just to try and mute those thoughts. For example, a terrifying obsession over germs leads to the compulsion of constant hand-washing just to temporarily ease that agonizing worry. Okay, it is absolutely vital that we bust a super common myth right here and now. Post-traumatic stress disorder is not just for soldiers. It occurs after someone has experienced or witnessed any traumatic event. Literally, it can happen to anyone. It brings on debilitating flashbacks, nightmares, and severe anxiety, making it incredibly hard for the individual to just function in their day-to-day life. The good news? Relief is highly attainable for all of these conditions. Cognitive behavioral therapy, or CBT, along with certain medications, is heavily proven to reduce the debilitating symptoms for both anxiety disorders and OCD.
For PTSD, therapy is also the key, specifically trauma-focused therapy. This helps the brain safely process the events that initially triggered the condition in the first place.
All right, on to Section 3, Perception and Identity.
First in this category, we have schizophrenia. Often popping up in young adulthood, it deeply fractures how a person perceives the world. And the core symptoms aren't just confusion, right? We're talking about active hallucinations, like actually hearing voices or seeing things that aren't there. It also involves delusions. Delusions are these strong, unyielding beliefs that simply don't match reality, like a person believing they're being stalked or that they possess special powers.
That brings us to dissociative identity disorder, or DID. You might know this by its old name, multiple personality disorder. DID involves the presence of two or more totally distinct identities or personality states residing within one individual. People with DID may feel like entirely different selves take control of their behavior at different times. It is a profoundly complex condition, and it often develops as a psychological response to survive severe, unimaginable trauma experienced early in childhood.
Because these specific disorders alter reality and identity itself, treatment requires some highly specialized intervention. For schizophrenia, antipsychotic medications are the absolutely vital first step to help manage those hallucinations and delusions. For dissociative identity disorder, the path to stability usually involves intensive, long-term therapy with the specific goal of safely integrating those distinct identities back together.
And finally, Section 4, Development and Coping Behaviors.
Let's look at autism spectrum disorder, or ASD, which fundamentally shifts how a person communicates and interacts socially. What's truly fascinating is how our understanding of this has evolved over time. We now recognize it as a vast, non-linear spectrum rather than a single checklist of traits. Individuals might struggle reading social cues, making eye contact, or engaging in typical back-and-forth conversations. Yet, on the flip side, they may possess brilliant, intensely focused specific interests or display repetitive behaviors that help them self-soothe.
Next is attention deficit hyperactivity disorder, or ADHD. While it's usually diagnosed in childhood, a ton of people live with it well into adulthood. Now, I really want to clarify something important here. ADHD isn't just about being a little fidgety. It's a persistent, exhausting mix. Inattention makes it hard to stay focused. Hyperactivity leads to constant restlessness. Impulsivity drives quick, unthinking decisions. This means someone with ADHD frequently loses things. They struggle heavily with time management, and they find it highly challenging to follow through on daily tasks.
We also need to talk about eating disorders. These carry severe physical and emotional consequences, and they actually often co-occur with underlying anxiety or depression. They manifest in highly distinct ways. Anorexia nervosa involves severe restriction of food intake to lose weight. Bulimia nervosa is a dangerous cycle where individuals binge eat large amounts of food and then purge through vomiting or excessive exercise. Lastly, binge eating disorder involves excessive, uncontrolled eating, but without that purging phase afterward.
Then there are substance use disorders, which involve the compulsive use of drugs or alcohol despite catastrophic negative consequences. This compulsive use actually alters the brain, leading to a chemical dependence where stopping causes painful physical withdrawal. But we absolutely must frame this correctly. Addiction is a chronic disease, and with proper treatment, recovery is incredibly possible. So, how do we best support people facing these final conditions? Well, early interventions like speech, occupational, and behavioral therapies are amazing at helping those on the autism spectrum thrive in their own unique and wonderful ways. For eating disorders and ADHD, therapy and nutritional counseling provide the necessary scaffold for managing those day-to-day challenges. And for substance use disorders, medication-assisted treatment paired with the incredible power of support groups literally saves lives.
Well, we've covered a lot of ground today, mapping out 12 highly complex conditions and bringing some much-needed structure to the often misunderstood human mind. So I want to leave you with one final thought. Now that you understand these clinical realities, how will this knowledge change the empathy you show to others? When we truly understand the mind, we replace judgment with curiosity and fear with empathy. Thank you so much for joining me on this explainer, and as always, keep learning.